So the objective for this started.
Yes.
Bismillah ar-Rahman. The objective for this is just to demonstrate the bony parts. Okay. The other details like the attachments and other, if they come on the way, I will try to help you. Otherwise, my theoretical part will help you. Okay. So this is skull. Is skull or cranium or what? Cranium. Why? Because the mandible is missing. Okay. Now this is called vault. We cut at this level to remove the vault and remove the brain for specimens along with the meninges or without the meninges or some. Okay. So here we have in the front we have frontal bone, 2 parietal bones and 1 occipital bone. Good. So this is frontal bone, parietal bone and occipital bone. I told you tuber. Tuber is an eminence, an elevation. See here you can find elevation sort of. This is another elevation. Here another elevation. So tuber, what? Parietal tuber. Same, we have some elevations here in the frontal. So tuber frontal or frontal tuber. This is coronal suture in adults, of course, remember. In children, there is a anterior fontanelle, which is very important clinically. Why? Because it has a depression in dehydration and in raised intracranial pressure, it can go up, it can bulge out. Then we have sagittal suture. Okay, and then we have lambdoid suture. The junction here is called bregma. The junction here is called lambda. Okay, here you may find parietal foramens here and here. In the actual skull you may find. This is inner of the vault. On the inner of the vault you may find some of the pathways of the vessels like this. Okay, you may find. Okay. Now this is internal, it's not our objective today. We have to follow here. So start from here. Frontal bones. Okay. After that, 2 nasal bone, one here, nasal. With internasal suture. The junction here is called nasion. The flat surface just above is called glabella. Then this is external nasal aperture or opening. Sometimes you can see some, if it's a bony model or a real bony skull, you can find the concha, because the inferior concha, which is a separate bone. Then here is a nasal spine, anterior nasal spine. This is called anterior nasal spine. On the back we have posterior nasal spine. Okay, so anterior nasal spine, posterior nasal spine. With the nose we have anterior aperture or opening and posterior aperture or opening with 2 cavities, nasal cavity right and left. This sometimes known as choana. Okay. Then I told you pterygoid plates, 2 pterygoid plates. See here, 1 pterygoid plate medial, 1 here lateral. In between is the pterygoid fossa. Same here. This red color is the muscle attached, one of the pterygoid muscles. Here medial pterygoid plate, here lateral pterygoid plate, pterygoid fossa. Here is the vomer, which is a part of nasal septum, the bony part of nasal septum. Here you can see some another septal part of the. This all is maxilla with alveolar arch. When I say arch, it means an arch-like structure which has multiple openings called sockets, and the sockets are there to fix the teeth. Then canine eminence. You can feel even canine eminence, the elevated part of orbit, orbital margin, orbital cavity, orbital margin, orbital cavity. Okay. Some of the important foramens here are here. You can find ovale. This is ovale. Here is the ovale. Okay. This is ovale. Better with this one. Ovale. Then we have a small, just near to it, spinosum. S for small, S for spinosum here. Okay. Then we have lacerum on the medial side. This is lacerum. Again, ovale, foramen ovale, foramen spinosum, foramen lacerum. Same here, of course. Ovale, spinosum, lacerum. Go on the sequence back. Carotid canal. You see, in all the foramen, I can cross it. I cannot cross the canal. Why? Because the pathway is S-shaped curved. So that is the reason I cannot enter into the canal from here. Of course, if it's a real bony skull, I may be able to pass a soft wire which can traverse the canal, maybe. After that, we have jugular foramen. This big one is jugular foramen. This here, jugular foramen.
Yes.
Okay. After that, we have, we finished ovale, spinosum, lacerum, and carotid canal and jugular foramen. In the middle part, let's finish. This is the basilar part of occipital bone with pharyngeal tubercle and foramen magnum. On the sides, condylar part of occipital bone, which is there to make the joint with the first cervical vertebra, like here. This is associated with two openings, one front, one back. Some books say anterior condylar, posterior condylar. The actual hypoglossal name is hypoglossal and posterior condylar, or hypoglossal canal, posterior. Then foramen magnum. After that, foramen magnum, you have external occipital protuberance, crest, leading to a protuberance, external. Why I'm saying external? Because there is an internal also. But we are not concerned, it's not our objective at the moment. Okay? On the side, you will find a mastoid process, and a styloid process. This one.
Styloid too.
Of course, both here and both here. Mastoid process, styloid process. In between the two is the stylomastoid foramen here, and stylomastoid foramen here for fissure. On the back of mastoid, we have a mastoid foramen here and here. This is just a demonstration of, zygomatic arch, styloid process, external acoustic meatus. Why I'm saying external? Because you will find an internal. Later on, we will cover it. I think this, if I keep the skull in a cranium in a good shape, you will find the ligamentum nuchae is attached here, and some muscles which you will find later on in your objectives. These superior nuchal line, highest nuchal line, superior nuchal line, inferior nuchal line. Temporal fossa, let's see. Here we have temporal lines, superior and inferior temporal lines, which are in line with this zygomatic arch in front, lowerly, and here to the orbit, the back of the orbit. This depression is known as temporal fossa. Below is infratemporal fossa, and later on we will guide you to the pterygopalatine fossa. Pterion, I'm not sure it's very nicely visible here, but pterion is a junction H-shaped suture here, which is between frontal, parietal, temporal and sphenoid bones. This is pterion. The importance is you can even find the pathway of the blood vessels here. Middle meningeal artery, it has two branches, anterior and posterior. It is a common site for anterior, and when there is a trauma on the side of the head, it is the most common site to be damaged. And the bleeding from this branch can lead to sometime unconsciousness or coma, depending upon the amount of the bleed. Okay. In opposite to that, we have asterion, and you know it from my theory. Anterior fontanella is one of the most important here, diamond shape. Why I'm saying most important? Because it's big, it's clinically the largest, it's clinically very obvious to find, easy to find, and it almost late to ossify or close. So it's a very big gap for any clinical issues to find, like dehydration when it is sunken, or raised intracranial pressure when it is. Late closure can be associated with hypothyroid cases like, or prolonged crying can sometimes give you elevated. That is temporary, of course. On the back, we have posterior fontanella, On the back, we have a posterior fontanella, not so obvious and common, as large as the anterior. Here we have on the sides in my theoretical sphenoid and mastoid, but they are again very small and less important clinically until you become a pediatrician, inshallah. Thank you. I hope things are clear.